My name's Jack. I'm here with Jane Luddington from St Vincent's Hospital in Sydney, correct?
That's right, Jack.
Good. And Jane has come here to present a paper at Medicine's Management 2015, and it's about post-operative diabetes. Is that correct?
That's right. What we're doing is we're looking at that time when a person who has needed an insulin infusion is stepping down from that need. So that insulin infusion is ceased, and that first couple of days when they are transitioning on to subcutaneous insulin, and typically that's a time when they are transitioning in care, stepping down into lower dependency care, starting to eat and drink, and our findings were that that was an area where we could do better at managing their blood glucose levels.
So, and you're part of a multidisciplinary team who's put this together?
Yeah, I'm very fortunate to work in a tertiary referral hospital which has a fabulous multidisciplinary diabetes service. So as a pharmacist, I can contribute to that as well, but obviously I'm working with nursing, medical and other allied health colleagues.
Do you want to shout out the other people who have been involved in the paper?
Yes, I work with a fantastically dynamic clinical nurse consultant in diabetes, Joanne Taylor, and Jerry Greenfield is the director of our diabetes service. And we've had tremendous support too from the intensive care and cardiothoracic staff and everybody that we've come in contact, really. Everybody's been very supportive, which is great.
From what you were saying, you've collated some of the information retroactively, which is unusual.
Well, this was a problem that anecdotally had been noticed in patients that were seen in the hospital, that at this time their blood sugars were higher than we would have liked to have seen. And so what we did was we went back and looked at a year's worth of patients of this and to see if this actually was true or we were just seeing a few unfortunate people. And so what I'm presenting is the results of that audit over a year's worth of patients who had coronary artery bypass surgery and needed insulin infusions. So this couple of days post-insulin infusion. And then I'll talk a little bit about the fact that we shared that information with some of our colleagues from intensive care and cardiothoracic surgery, and there was general agreement that we could probably do better at this. And so we've developed a guideline on how we might improve that, and we've started to implement that in a few patients, and we are prospectively capturing that information. And so far it seems to be encouraging.
Terrific. So more recording and then you can spruik it to others.
That's right. That's the whole idea. So, it does seem to be improving patients' blood glucose management in that period of time, and hopefully that's improving their outcome.
There you go. So the paper's on, when is it?
Sunday. I'd love to encourage all pharmacists to get involved as much as they can in diabetes. I think it's an area where blood glucose management is often overlooked when people are in hospital and their acute condition sometimes takes priority. But I think that all pharmacists can contribute actively in this area and help to achieve better patient outcomes.
Terrific.
Thanks, Jack.
Thank you very much.